So we have a post-op patient that just had a gallbladder removed. We went in pre-op and just kind of instructed them on what therapy we would be working with them. We're going to do the incentive spirometry, just kind of helps with lung expansion to prevent atelectasis and pneumonia. So they're all informed about that. They went through surgery, everything went good. It is now our time to go in and start the therapy. So we're going to go through and check the patient's chart, looking for their pain medication schedule that could alter performance of the therapy, check for previous vitals, check a chest x-ray if there was one taken. So we can knock. Hello, I'm Abby with Respiratory Therapy. I'm here to work with your incentive spirometry therapy. It should only take about 5 to 10 minutes. Can I get a name and date of birth, please? Thank you. At this time, we can do our pre-assessments, listen to lung and breath sounds, check vitals. Then we are wanting to have them first sit in an upright position. So that can include bringing the bed of the back up, if the bed is able to raise, or if it's having the patient, they're not in that much pain, swing their legs over and sit on the edge of the bed. Our lady is 5'8" and only 55 years old. So 5'8" and 55 years old. And our predictive is 2550 according to our chart. So on the bottom here, we can put the predicted as 2550. We can enter their name, the date, and the room number they're in. When they're actually doing the therapy, our goal is to at least get 1/3 of that. So we're looking at somewhere between 700 to 800 starting out. We'll start that out as a goal for the patient. We'll start at 750, let's say. So we are able to adjust this to 750. And as they as they do it longer, we're able to reassess their goals to higher and higher, hopefully. So once we have them sitting upright, they did have gallbladder removal surgery. So we'll just want to do some splinting, so that may include putting a pillow over the incision sites and just applying pressure so that it's not as painful while doing the therapy. We're measuring volumes here. So we'll have them take a normal breath out, and we're going to have them inhale deep. Take a deep inhale and hold their breath for 3 to 5 seconds if possible. As they're doing this, the white thing will go up, and then we just want them to hold that and then exhale. We want to do that roughly 6 to 10 times an hour. So let's say they're with it, they understand the therapy, we can leave them to do that every hour. Otherwise, if we may need to come in the next hour and try to educate them a little more, that's perfectly fine. We will want to come in every once in a while to reassess their goal and make sure they're reaching those marks. So she completed 6 to 10 breaths. Her technique was phenomenal. So following that, we can do our post-assessment, listen to breath and lung sounds, vital signs, see if they improved. Then we'd want to also reposition them back in bed, make sure they're comfortable, not in any pain. Then before leaving, we want to make sure that this is in reach. If they are performing it on their own, we just want to make sure they're not doing it too fast, otherwise we'll get some hyperventilating there. So just nice controlled breaths are needed. We can come in and check. And then if the patient doesn't have any other questions, we can put that on the bedside table beside them, and then we are able to do some charting.